everyone, welcome to my YouTube channel. This is Dr. Sankari Kasi and I am a family medicine board certified physician practice based in California. Today we are going to talk about an interesting as well as a common topic. Guess what? Hair loss in midlife as well as in menopause. I'm going to review this topic with what are all the common causes for the hair loss and what are all the diet as well as the nutrition factors that can help you with prevention of your hair loss. And another important question is, are any supplements are out there that has been helpful for the hair fall? I'm also going to discuss about what are all the treatment options as providers we can recommend to our patients, and also the cosmetic dermatology options that is available for the hair loss. If you have not subscribed to my channel, make sure to subscribe to my channel. Let's get into the topic. Hair fall could be very stressful for us. Even by looking at the amount of the hair fall, it usually stresses us out. I'm sure a lot of us feel the same way, that even looking at the hair fall, that even promotes us a lot of stress to us. So let's look into what are all the common causes for hair loss for women in their midlife. The number one is Telogen effluvium, which is a generalized hair loss or thinning of the hair without any balding. What are all the common causes for that would be either physiological or emotional stress. For example, a patient goes through a chronic illnesses, or they have been sicker in their life for a longer period of time, or if they have been going through some emotional stress. And also patients who have been going through weight loss journey, if they have been drastically losing their weight and their nutrition is not fully promoted, and I see a lot of hair loss in those patients. So the treatment options for them is the diet as well as the nutrition. It will be the first step for them, and then for that I usually ask them to eat any types of the fruits as well as the vegetables which is multicolored, and then also cruciferous vegetables which is like kale, broccoli, and also Brussels sprouts and different colored vegetables, cabbage. They're all very helpful. Make sure that you eat them because it promotes a lot of vitamins, minerals, as well as antioxidants to your food. So how do you do that? What I usually do is I go to the local farmers market and I see different colors of vegetables like cabbage. They come in purple color, the regular color, cauliflower with the purple, yellow, white, and also different types of the rainbow carrots, which is a purple, yellow, orange types of carrots. So go to your local farmers market, find out a different variety and different colorful of the fruits and vegetables, and include that at least 1 to 2 servings per day. I asked this question to a lot of my nutritionists about what are all the things that we can include in our diet that can promote or prevent the hair loss, and every one of them has mentioned the same thing. Add as much as cruciferous vegetables, add as much as colorful vegetables in your plate, and that will prevent you from your hair loss. And the other next important step I ask my patients is, please go ahead and talk to your doctor and get your lab test done. I usually recommend a complete blood count, a comprehensive metabolic panel, and then an iron studies which includes the iron as well as the ferritin, and then also thyroid studies for us. And then if there are any other nutritional deficiency that your doctor think that would be low for you, and they can include that in your labs, and make sure to get those labs done, and they'll be able to supplement what are all the vitamins that is in the lower level for you. So ferritin is a very important component, even though most of the labs shows that more than 20 is normal. Even though it's more than 20 and it's normal, but for a good hair growth, you need a ferritin of more than 100. So make sure that you take lots of vegetables, fruits, as well as iron containing food that can promote you to increase your ferritin level. So the treatment option would be the minoxidil, which is available as foam as well as liquid component that you can apply to your scalp. Make sure that you talk to your doctor regarding the concentration of the minoxidil and how to apply them and how many times per week would be helpful for you. The topical minoxidil, which will be helpful for you, and if you apply that few times per week, which will also helpful with the hair regrowth. Make sure to give it a try for at least 3 months, because I see that the first 3 months you could still have some shedding of your hair. So do not get frustrated. Give it a 3 months of try before you switch to onto the oral minoxidil. The next common cause that I see that is female pattern hair loss, which is FPHL. So this is the thinning of the hair on the crown as well as the part line, and it is more common in postmenopausal women. It could be because of androgen sensitivity as well as those hormonal changes that happens to them. So first of all, the same thing I would do with talking to your provider to get the blood test done, and then focus on your nutrition. And then the third step would be what are all the treatment options that is available for that. You can definitely start off with the topical minoxidil for 3 months, give it a try, and if that's not helpful, you can talk to your provider, because minoxidil is also available as oral preparation that you can take it, which will also be helpful for your hair loss. Another one is if you have symptoms of androgen excess, such as painful cystic acne or other symptoms of androgen excess, your doctor will be able to provide you some labs, and depending upon that, you can also take anti-androgen options. The first option would be the spironolactone or aldactone, which has got its anti-androgenic properties, and it is available as an oral form. So talk to your provider and they'll be able to prescribe that medication for you. And in this medication, we also have to make sure that your potassium level as well as your blood pressure is checked. Some patients who have signs of like androgen excess, and definitely they respond very well to the oral spironolactone. And if you're one of your patient and were having some painful acne, and this spironolactone will be a better option for you. So the next common question is the menopause hormonal replacement therapy, is it going to be helpful for the hair loss? No. So the hormone therapy is not an indication for the hair loss. We do have other indications why patients get the menopausal hormonal therapy, but it's not indicated for the hair loss. And then the next common question that has been asked multiple times is, what supplements can we take for the hair loss? Some of them, they take saw palmetto, zinc or biotin. There are no specific scientific evidence supporting these supplements to be helpful in the hair loss, and there are no conclusive evidence that taking these supplements will be helpful for the hair loss. So primarily, the most important thing is the diet as well as the nutrition is the main aspect that we discussed before, will be helpful for the hair loss along with the other treatment options. And then I also wanted to end up saying about what are all the cosmetic options available for the hair loss, and you can talk with your cosmetic dermatology. There is low level laser therapy for the hair, and also there is platelet rich plasma injections, we call as a PRP injections, that is also helpful for the hair loss. You can talk to your cosmetic dermatology regarding those options. I hope this video is helpful for many of us who are going through this transition with the menopause and the hair loss and midlife. Make sure to talk to your provider regarding the treatment option that is available. And also make sure to subscribe to my channel and turn on the notifications so that you'll get the future updates. Thank you for watching, and I hope to see you all in the next video.